Episode 51. In 1951, the active ingredient for the oral contraceptive pill was created in a Mexican lab. Yarmer Yager, who I think is the third greatest penguin of all time, is 51 years of age. And in 1951, the US government and the Federal Reserve came up with the Fed Treasury Accord, which gave the Federal Reserve full authority on monetary policy without any political influence. Beyond MD, episode 51, here we go! Happy Friday, everyone. Thank you so much for joining me again on Beyond MD. Today's episode, we will be talking about locuming as a physician and the various benefits and challenges that come with locuming. I'll be talking to Dr. Mike Fralick, who is a clinician-scientist at Mount Sinai Hospital. Such a nice guy, so easy to talk to. Certainly a lot of wisdom in his message. After talking to Mike, I went back and reflected on some of my own experiences when I did my locum back in the day, and I came up with a bit of a list, what I think are the key benefits of locuming. So, as many of you know, I did my fellowship in San Diego 2015-2016, and that year was financially challenging. I was earning $10,000 for the year, and despite being organized, at least coming down with my wife's savings for that year, we were eventually running out of money, and I needed money badly. We all needed money. So what I decided to do was I took a few weeks and I went to Calgary, Alberta, and I ended up locuming for a week and a half with a group that I ended up joining. And there were many, many benefits that came from this. So here we go. Number one, locuming gives you real life experience into what it's like to be a staff physician. So even though my locum was pretty short, I got a glimpse into what my life would be like as a radiologist and what it would take to succeed in that role. And I tell all the residents who come and rotate with us at North York General Hospital, the more volume you do, the more prep you do, the more battle you do now, the better off you'll be in the long run. I am unequivocally that pain-in-the-ass staff physician who says to never turn down a consult. And for the radiology residents, it means to look at as many cases as you can coming off the scanner. You will be better off for it. Benefit number 2 of locuming is the chance to explore a practice. When I was on the ground in Calgary, I got first-hand experience into what the group was like, what the city was like, what the practice was like, what kinds of cases would I be seeing, who would I be interacting with. And it was so much more information than I could get from an interview alone. So if you have a chance to locum with a group that you may be joining, I would highly, highly consider it. Benefit number 3, when you're locuming, you are expanding your network. You are making new relationships. You are learning from the people around you. Friendships are born. All of this happened to me in Calgary, and I'm better off for it. Benefit number 4, I think this is so huge. If you have the desire to make a difference, if you have the skills to make a difference, and if you are credentialed, it takes some paperwork to locum, but you can have an impact anywhere. And that is by far the most beautiful thing about our profession. If you are credentialed, skilled, and you have the desire, you can go anywhere in the world and have an impact. I know people who have gone to Europe, who've gone to Japan to do fellowships. They're having an impact around the globe. It's truly, truly a beautiful thing. Benefit number 5, when you're locuming, you can travel, you can see new places in Canada and beyond. And benefit number 6, of course, this is a financial literacy podcast. Locuming allows you to generate an income, and in some cases, you may be making more money than you would have otherwise. So guys, I have to apologize for my audio quality in this interview because my mic did not register and I sound completely old school, but my guest, Dr. Michael Fralick, sounds amazing. And so Mike is a board-certified general internist in Canada and the US. He completed his undergrad at Queen's, medicine and internal medicine at U of T. Then he did a Master's of Science in Clinical Epidemiology at Harvard and his PhD at the U of T, which focused on the intersection between supervised machine learning and pharmacoepidemiology. So today, Michael is a clinician-scientist at Sinai Health and assistant professor at University of Toronto's Faculty of Medicine. He also spends a fair bit of time locuming in Sault Ste. Marie, as we will talk about in this interview. For the last 4 years, Mike and his brother John have been running the Rounds Table podcast, which is a phenomenal podcast for all doctors wanting to stay up to date on the latest randomized control trials. And Mike is also on the board of New England Journal of Medicine Evidence, which is a new journal in the New England Journal of Medicine family. So with that, here's my interview with Dr. Michael Fralick. Hey, Mike, welcome to the podcast. Where's the podcast find you today?
Yeah, happy to be here. I'm in East York working from home, which is always nice.
Oh, I love it. I love it. So, Mike, you have, I think, a really interesting path and journey. So maybe just take a minute to just tell the audience kind of who you are, what you do, and how did you get to where you are today?
Yeah, for sure. So I'm a general internist, I guess more specifically a clinician-scientist. So after my 4 years of internal medicine in Toronto, I did a master's for a couple of years in Clinepi. I did a PhD in the intersection between machine learning meets clinical epidemiology, and then a applied research fellowship. So how do you actually implement machine learning into clinical care without all of the hype, like actually do it? So that's been a ton of fun, but also I love patient care. And I think I never wanted to be that clinician scientist who seemed somewhat inept when it came to clinical skills and managing and running a team. So, I've been a clinician scientist and assistant professor for the past, I guess, 4 years now almost at U of T, predominantly at Sinai. But I've also been locuming in the SU and Michael Guerin and elsewhere. And, I'm happy to sort of chat more about that.
Yeah, absolutely. So I think the mix of work that you're doing, it sounds really interesting. So for us today, I guess we'll focus more on the locuming aspect. Although I wish we had more time. I would love to pick your brain on your more of your day to day. But okay, locuming. So tell us about your experiences in locuming. Just kind of give us a one-on-one. Like, what have you done up to this date, and what are you doing currently?
Yeah, so when I was a second year resident, I went up to Sault Ste. Marie. So it's a 8 hour drive north of Toronto, or an hour and a half flight. And it was just so nice because the second year for internal medicine is really brutal. Like, you're a senior resident, you're doing 1 in 4 call for a year straight. And by the end of it, I think I was burned out. And I go to the SU for this elective, and I see this patient, they emerge, and prescribe them antibiotics, and they're like, oh, thank you so much for your care. And I thought they were being sarcastic. And then the next patient I saw, her daughter was like, oh, thanks so much. We appreciate your help. And I realized, oh no, they're just really thankful. And it's really, really rewarding to have patients say thank you for the care that you deliver. And I really felt like when I was in the SU as a resident, I was truly a general internist. I think in downtown Toronto, we have every subspecialist at our beck and call, that I sometimes think it's like a detriment to our clinical learning. So that just really stuck with me. And then I got some really good advice by Dr. Nadine Abdullah, who's at Toronto Western, when I was in my maybe first or second year residency. And she said, after you're done your clinical training, spend some time outside of Toronto. And I really took that to heart. So for the past 7 years now, I've been going to the SU. I go once a month. Sometimes once every couple of months, all depending on their needs and requirements. And then I spent some time at St. Joe's as a locum physician. And then most recently, just started locuming at Michael Guerin as well. So that's a bit of a snapshot, at least, of how long I've been doing it and the current work I'm doing.
That's amazing. And Mike, as somebody myself who trained in a smaller program for residency, I was in Kingston, 5 years of diagnostic radiology. And I can tell you, because it was a smaller program, there were less trainees ahead of me or between myself and the staff. I found the experience, the clinical experience was wonderful. So I'm not surprised you're mentioning this from a locuming perspective. But now, how did you decide where you wanted to locum? Was it just based on your initial experience in Sault Ste. Marie, or was it from talking to people, or did you just want a drastic change from what you were used to in Toronto?
Yeah, it's a combination of the three, I would say. The two main points of contact for locums are Christine and Carrie in the SU, and they're such lovely and nice and friendly people that when I was done my elective, they're like, oh, you should come back up, and we love having locums. I thought, cool, you're so nice and friendly. I'll definitely do this kind of thing. And then a colleague of mine spent some time in the SU as well, and he sort of spoke highly about it. It's actually pretty easy to find locums. So there's this great website that's been created called Scout Health. And Scout Health is predominantly for Northern Ontario, but a nice way for individual physicians to try to find, short periods of work, and then a great opportunity for a bit of a one-stop shop, I guess. So, it is quite easy to actually find it. And then, definitely, as I sort of already alluded to, I wanted something different than the downtown experience where, as the attending physician, the times have changed, but maybe 7 years ago, as the attending physician, I have a senior resident, I have multiple junior residents, I have med students, and I think my own clinical skills can get rusty as a result. So those are definitely some of the key motivating factors.
And so now, as things stand today, do you plan to continue locuming for the foreseeable future? What's your true north when it comes to this? Why do you want to continue it?
Yeah, my true north is Sault Ste. Marie. I would say, pun intended. But like like right now, at least, I want to keep doing it for sure. Maybe once every couple of months. So I attend at Mount Sinai for 8 to 10 weeks, sometimes 12 to 14, depending on how busy things are per year. And I love that work, but as a clinician scientist, it's hard to do like a 14-day straight block of team medicine. All of my research stuff kind of falls behind. So I definitely plan to keep doing it. My wife, who is a veterinarian and definitely the much more sort of like logical of the two, she was like, well, why don't you just start locuming closer to home? Like, why are you going all the way to Sault Ste. Marie? And as I mentioned, we live in the east end of Toronto. So I was like, oh yeah, that's highly logical. And it's been nice to do that because, there's pros and cons, but one of the cons of the Sault Ste. Marie approach is that like, I'm gone for a few days. Whereas at Michael Guerin, I can sort of, walk 10 to 15 minutes, work really hard for a short period of time, and then come home and sleep in my own bed. But yeah, so I definitely plan on continuing to do it. I think mainly because I just thoroughly enjoy the work.
Very good. So maybe just take a second to summarize for people who are contemplating, should I locum? Should I introduce this into my day-to-day, week-to-week? What are the main positives of locuming based on your experiences?
Especially once you've completed residency, I think the main advantages are just like the sort of volume of patients you'll see. And, you don't have the same luxury of picking up the phone and calling whatever subspecialist that you need to reach. Like, I remember one of the first times I was up there locuming fresh out of residency, I got a consult for this complex patient who had multiple sclerosis, and they were worried it was like a flare of her MS. And the emerge doc said, we want you to see this patient. I'm like, I'm more than happy to see, but I think neurology should probably see this patient too. And they're like, oh, you are neurology. So I was like, oh, okay, it's time for me to learn. And I think downtown centers can be really good at giving didactic teaching. And, obviously there's so much to be gained, but there's also lots of like bread and butter things. So for example, as an internal medicine physician, I don't see a lot of NSTEMIs. I don't see a lot of patients with, seizures or epilepsy, because at a downtown center, they're just calling the specialist. So there's actually major gaps in our knowledge and our skill set just from residency itself. So definitely that's one major strength, right? It's just sort of improving your clinical skill set. And it's like a big jump in terms of, I think, knowledge and practical skill set. And then, of course, financially, right? So fresh out of residency, I had a ton of debt, and you work hard, but you also make, really good money. You're well compensated for your time. And I also think it's just like refreshing. I've made a good set of friends now in the Sioux, and when I go up there, I'll tack on an extra couple days and we'll go, golfing at the end of it. And I'm still trying to convince my wife for us to go up there and, rent a cottage. I do a couple days of work. So I'd say it's sort of the three, right? Like clinical skills, especially fresh out of residency, financial, and then from a lifestyle standpoint or exploring, it can be quite fun.
It's amazing, Mike. You mentioned that you've made friends up in Sault Ste. Marie. You guys go golfing together, and like on my podcast, we talked about the pillars of wellness time and time again. But then when you look into the evidence, and I know we all tend to be evidence based, but our relationships, that is probably the biggest contributor in our life to our overall wellness and happiness. So it sounds like you're getting that from locuming as well, which is a beautiful thing, I think. So.
Yeah, and I should just mention that as well. I think the other aspect as a clinician scientist working in a downtown center, we're always talking about grants and papers and whatever. Mm-hmm. And I think in residency, you're surrounded by physicians who it seems like their life is medicine, right? And then in the Sioux, it's not that at all. It's like, no, they all have lives. And they work in the hospital to make money, and to, whatever, feed the family. So it's a total inverse. And when I'm up there, no one's talking about research or grants. They're talking about whatever, the golf course they are at, or like the new cottage they're going to build. So it's just so refreshing because you're like, oh, wait a second. There's a different approach to medicine than maybe what I saw as a resident and the attending physicians that I worked with.
Yeah, well, you mentioned you like to golf. We should golf. I'm an avid golfer. I'm always trying to get out more. Every year, I'm sneaking in 2 more rounds than the year before. Maybe not up in the Sioux, but in Toronto somewhere. We should hit up the links for sure. But look, one question I have about locuming is, to me, the concept of locuming, it seems to introduce this concept of time freedom and geographical freedom. Like to me, those are very, very important concepts. What do you make of this? Does that apply for you as well?
I think so because it's sort of like my work in the Sioux. I'm on call for 48 hours. So let's say I fly up on a Friday night. I work Saturday 7 a.m. until Monday 7 a.m. And during that time period, I'm working very hard. I'm in the hospital maybe 16 hours a day. But then when I'm done, I'm completely done. And sort of the amount that you bill in a 2-day time period is almost the same as like 1 week of attending like on the general internal medicine ward. So I sort of feel like I can do less weeks of team and get more time back. Like that combination is really nice. And then, yeah, from a geography standpoint, exactly. Like you sort of pick wherever you want to work because you're a bit of a hired gun, right? You pick up shifts when you want, you do the medical work, but you're not expected to do anything extraneous to the actual clinical work, which is quite nice, actually.
Mike, why don't you also take a minute or two to talk to us about the negatives of locuming in your experience? Because right off the bat, for me, while you get time and geographical freedom, it probably introduces some level of uncertainty into your life too, if you're relying on locums quite a bit. But I would just love to hear your take on the negatives.
Yeah, it's a good question. I think certainly with each passing year, it's just sort of getting harder and harder to have like the stamina to do it. And then also the recovery afterwards. It's like, sure, I might have only worked for 48 hours, but like I need a recovery day or two after the fact. Now, having said that, I find the same thing when I'm, on the clinical teaching unit. I still need some recovery after that. I think, it's obviously like unfortunate that these communities need locum physicians. So you sort of very quickly realize how fragile our healthcare system is, especially in, less urban settings. So you sort of have that like, man, I don't always know if people are getting the same quality care, right, that they would receive if they were living closer to like a major urban setting. There's a bit of a hassle factor, right? So there's like some paperwork you have to fill out, the onboarding stuff when you first start at a hospital. I find those things frustrating. So, that's a con as well. I'd say those are some of the main cons that kind of come to mind right away.
I'm just curious, when it sounds like you spend a lot of your time in Sault Ste. Marie, but over there, did you have to navigate a new electronical like medical record system, or is it more paper charts out there? Like, because you mentioned that locuming, the income, you're probably, the money you're earning, you're probably working more efficiently. So I'm just wondering, in terms of EMR versus paper charts, like what's your experience been?
Yeah, they started with paper charts, which was just so glorious and enjoyable.
Yeah, right.
Yeah, like especially for admitting a patient into hospital, like you just write something down. There's no like, are you on the right visit encounter? No, I'm just writing paper orders down, and then they go in the system, and the patient's admitted. So yeah, I did have to learn a new system, and then that system then got upgraded, which again is a sort of another frustrating point. But they are there to help. So I remember the first time I was there and the new system was put in place, like somebody came from IT just to help me for the first couple of hours. And like I would never get that in downtown Toronto, right? But you're right, that is another sort of that can be a point of friction and frustration, at least initially, just learning a new system. It's usually simpler though, because as like the general internist, I'm covering derm, endocrine, GI, neurology, stroke. So there's sort of less of, like, where does this patient go to and what's the system? No, I just see everyone kind of thing. But you're right. That is the other potential drawback for sure.
Okay, let's move on to the finances of locuming. To me, this is interesting. So what's the basic model of compensation when you're on locums? Because, in the academic centers, at least, some of us are fee for service, some of us are salaried. How does it work when you're locuming?
So when you're locuming, there's different sort of buckets of money, I would say. So let's say you go somewhere in Northern Ontario. The bulk of your earnings will be fee for service. So in a very busy on-call, in a very busy 48 hours, I would see up to like 40 new consults. So, like 40 new consults times, I don't know, like $300 on average. If my mental math is right, it's like $12,000.
Yeah.
So that's, that's a lot of money. And then, if you're doing locuming where it's like not that busy, you can also just opt to get a per day amount. So for GIM, that per day amount would be like, maybe it's $1,500, $2,000, and you'll run a list of maybe 8 to 10 patients. So not all that busy. So that's one bucket of money. And then you get stipends when you're in the north. So that covers your sort of daily costs. It's about $300. You also get paid for your travel time. So that's another bucket of costs. And then there's on-call bonuses that you get. So back when I was a grad student and I was going up there in a very, very busy 2 days, you could make anywhere from $12,000 to $15,000. And before they had a cardiologist, I would also read the ECGs, and it's like, $5 a click, which may not sound like that much, but when you're like fresh out of residency, you're like, yeah, like this is fun. Every click is $5. The times have changed a bit. But those are sort of the main ways that you get paid when it's in an underserviced area. The daily amount obviously varies depending on the specialty that you're in. But then when I locum at somewhere like Michael Garron or St. Joseph's Hospital, same thing, right? So your fee for service is the bulk of the money that you're receiving, but they also give on-call stipends anywhere from $500 to $1,500. So that's sort of the type of way that you get paid for your time up there as a locum physician.
So the on-call stipends, that's per call shift? That's what they will pay you kind of on top of what your billing fee for service, or?
Correct. Yeah.
Wow.
Yeah.
Wow. Okay.
Yeah. So it's like a hospital on call. And then when I'm in the SU, I'm also the stroke physician on call. So there's a stroke on call stipend as well. Yeah.
Now, in terms of billing, because for a lot of us, like for me, it's a bit different as a radiologist because our billing codes are essentially embedded into our PAC software. But for a lot of other physicians, they have to figure out how to bill efficiently. I'm just curious, Mike, in your experience, did locuming teach you those skills, like to bill efficiently, to kind of optimize your day-to-day?
Yeah. And for us, it's not embedded within the EMR. It would be incredible if it was, because I don't enjoy the process of billing. I started out with Agent Plus, and their software is just not that great. And now I use MD Billing. I have no affiliation with either, I should mention. But it is quite efficient, so that now I'll see a batch of 5 consults and then I will just bill on the spot. It's pretty easy with, the app and the desktop version they have. And then I think how people bill in the community is different than how people bill in a downtown setting, because in a downtown setting, a lot of physicians, the bulk of their earnings don't come from billing. So they're a little bit less savvy and sometimes, a bit not the best people to learn from. So I think it was also just interesting to hear from the community physicians, oh, well, this is what I bill in this scenario. And, oh, there's a code for that. I was like, oh, I had no clue. So yeah, that's kind of been my approach, and definitely it's helped me to be, more efficient with billing and also get a sense of what other people are doing and how they're billing for their work.
Okay, so let's talk quickly about what expenses can you write off when you're locuming, because you're going to have to travel up there, you're going to have to stay somewhere, so you have accommodation expenses. So can you give us a bit of a summary on what expenses are written off here?
Yeah, so they actually pay for all of those costs. So they pay for your flight, they pay for the hotel, they pay for the rental car, and they book it all for you. So it isn't that sort of frustration and friction of having to book those things yourself. They pay for the gas. You have a per diem for your food. So in the end, I don't write anything off because I'm not paying for it.
But being an academic physician, let's say you locum somewhere for a few weeks, you make X amount of dollars. What are the tax implications? Talk to us about that.
Yeah, so my colleagues in the SU are always amazed that's a nice way of putting it when I tell them this. So all the money I make in the SU, it all flows through Mount Sinai. It flows through their practice plan. And that's because I get salary support as a clinician-scientist. So I am billing, and then those billings go into the pool at Mount Sinai. I don't actually, it's not like I'm sort of receiving another check for my clinical duties in the SU, if that kind of makes sense. So it all just flows through Mount Sinai, and most hospitals in Toronto work like that. I have no clue how hospitals work outside of Toronto, but I imagine they don't work like that.
Okay, so what you're saying is you earn X amount of, or you bill X amount of dollars, but that money is going to flow through Mount Sinai and then kind of get distributed. Kind of the pie will be split then, essentially. Okay.
Yeah.
Fair enough.
And I should say, Atin, like when I was a grad student, it was different. As a grad student, I'm not part of a practice plan. That is when it was most sort of lucrative for me to do that work, because all of those billings were coming to me, and then the tax man, of course. But the actual financial gains of doing locuming right now, there aren't a ton at the stage that I am in my career. I still do it because I feel like it gives me my time back, because I'm not doing as many weeks of service at Mount Sinai. And I love direct patient care, and I've created this sort of, like, it's a fun group of people to work with. Mm-hmm.
Last thing on the financial side, Mike, is contracts for locuming. Like, was there ever a time where you were trying to set up a locum and then maybe something came up, like let's say it was the SU or somewhere else, and then they said, well, Mike, you know what, we were actually able to hire like a permanent hire now, and we don't really need your services. Like, did anything ever fall through the cracks? I'm just wondering, from a contract perspective, negotiating, like, do you have any words of wisdom there?
Yeah, it's a good question. Now that I think about it, there really wasn't a contract in place. It was sort of like, you now have hospital privileges, you can now come work here. So yeah, there actually isn't a contract, but there's never been a shortage of work. And even when they do hire somebody full time, usually then, like, I don't know, somebody leaves or somebody does less work, kind of thing. So there's always work to go around. Some of the locums have then become permanent physicians in the SU, and that is when a lot of negotiating can get done. There's also standard packages. So if you're fresh out of medical school or residency, pardon me, like, they pretty much pay off your student debt. They pay you to relocate. And you get like a base salary, a very large base salary support as well. So some of the locum docs have then become permanent. My wife would not allow me to do that. And also, I like the combination of a bit of academic and a bit of work in the north.
Mike, that's amazing. I love what you're doing. And maybe we could just kind of finish it up with, do you want to take a few minutes to tell people about your podcast and what you're doing? Because I would love for my listeners to get exposed to that as well.
Yeah, that would be great. And one thing I shouldn't forget to mention is that I've created an elective. So if there's residents who are listening to your show, residents anywhere in Ontario can come to the SU for an elective. It can be up to 4 weeks. And there's no evenings, there's no weekends. You get a day off, at least a day off every week to explore the SU. So there's one for internal medicine residents, and then another one I just created for family medicine residents. So for any listeners that want to spend time, you reach out to me, and I'd be always happy to chat. And then, so the podcast that my brother and I co-host is called The Rounds Table. The Rounds Table, the primary audience is, I would say, like, staff physicians and maybe senior residents. So once or to twice a month, we sort of give concise summaries of potentially practice-changing randomized trials. So that's our primary focus. Sometimes we go off script a bit and talk about other topics. But and we took over the show, I guess, 4 years ago now, and it's been a ton of fun to do, and it's sort of forced me to stay up to date on the literature. So maybe some of your listeners will find it enjoyable as well. Maybe not your radiology colleagues, Yatin, who are listening to this. But they might be like, oh, geez, I went into radiology because I don't want to hear about this, randomized trial of some new diabetes drug. But
No, but Mike, what I love what you and your brother are doing is that you are keeping up to date with so many topics. And honestly, it's my belief that
if you do that, that can make your day-to-day in medicine much more interesting and gratifying. So I love what you're doing. Keep it up. And yeah, for the listeners, the Rounds Table, it's a wonderful podcast. I, as a radiologist, have tuned into a few episodes, and I like the format. It's very concise, so keep it up.
Awesome. Thanks, Yatin. It's been a pleasure to chat with you today.
Awesome, Mike. Take care, okay?
You too.
It's incredible that Beyond MD is now approaching 3 years. I'm always amazed at how much the podcast has grown and how many people continue to turn in for each episode. So I want to thank all of you for sticking with me and making all of this possible. I've truly enjoyed the journey. And if you continue to like what you're hearing, I would be so grateful if you can share the podcast with a few people in your network or give it a rating or a review. You can reach out to me at beyondmdpodcast@gmail.com anytime, and my social media links are in the show notes. I can't wait to share the next few episodes, which are going to be featuring the Loony Doctor. Until then, stay well, stay savvy.